The Describe PFD patch is a silicone patch which is infused with a liquid known as perfluorodecolon, otherwise known as PFD. The PFD liquid wicks into the inner silicone layer of the patch, and together they work to enhance laser-assisted tattoo removal treatments. We now have scientific evidence that shows when we treat with the PFD patch, the epidermal whitening, which occurs with traditional laser tattoo removal and limits the amount of treatment we can provide in a given session, does not occur to the same degree as it otherwise would. This allows us to do more treatment passes during a given laser session.
Our practice has been using the Describe PFD patch for several years now because it makes tattoo removal safer and more effective. And so now that I've seen what the patch can do, I wouldn't want to treat a tattoo without it. Before we begin treatment, we anesthetize the patient with a local anesthetic injection. Then we cleanse the skin with alcohol, just as you would with any laser treatment. Next, apply the PFD liquid to a foam tip applicator that is included in the box. The foam tip applicator is very important to use because it ensures the tattoo is saturated with the PFD. It should have a wet appearance. Next, remove the patch from the pouch, and once you remove the plastic film, you'll notice there's a smooth side and a tacky side. The tacky side will go on the patient. The PFD solution evaporates quickly, so you'll want to make sure that you put the patch on directly after applying the PFD. To make sure there is an even, smooth application that's optically clear, I like to use the heat of my hand to press down on the patch for just a few seconds. When we treat the portion of the tattoo not covered with the patch, you'll immediately see the laser-induced whitening. Normally, this would take about half an hour to resolve, so we wouldn't be able to perform any additional treatment on this part of the tattoo. When treating a tattoo, you should always use the maximum tolerated fluence, but with the Describe patch, we can increase the energy while still safely treating the tattoo. You can see that we're just treating directly through the patch, keeping the skin slightly stretched, so we have an even, clear field. If you do notice some whitening that occurs, even though you are using the patch, apply more PFD and wait until it clears. You'll notice that the whitening clears much more quickly than on the untreated side. Apply PFD between each pass when you're using the patch. Now we're ready for the second pass. Notice how there's still whitening on the side of the tattoo that does not have the patch, but the whitening on the PFD portion has disappeared, so we're able to go ahead and retreat. As you can see, there is some ink that has ejected from the tattoo into the patch. This is a common occurrence. To continue treating, remove the patch and apply more PFD to clear away the excess ink and to saturate the skin. Then reposition the patch to continue treating through an optically clear area. Continue retreating the tattoo until you've reached the clinical endpoints or the patch is no longer optically clear, up to 4 passes. When you're finished with the procedure, simply remove the patch and throw it away. The patch is meant for single use only. At the end of the treatment, you may have a little bit of PFD left in the pouch. I just apply that to the entire tattoo before putting on the dressing.
In our practice, the Describe PFD patch has become the standard of care for treating our patients who are undergoing laser-assisted tattoo removal.
After using the patch for several years and performing the clinical trials, I've come to realize that the advantages we saw in the trials translate to greater patient satisfaction and more effective treatments.